Wolff-Parkinson-White, an overview. In our previous lesson we learned about myocardial infarctions. Today, we will consider Wolff-Parkinson-White Syndrome, a relatively rare electrophysiological condition, characterized by sporadic paroxysmal supraventricular tachycardia. We will take a look at pathophysiology, diagnosis, symptoms, and treatment. Wolff-Parkinson-White syndrome is a congenital condition in which there is an abnormal additional electrical pathway in the heart, known as the bundle of Kent. To understand Wolff-Parkinson-White, we must first learn about the heart's electrical conduction system. An electrical signal originates in the sinoatrial node. It is then transmitted through internodal pathways to the atrioventricular node. When the signal reaches the atrioventricular node, it pauses for a few moments, then travels to the bundle of His, to the left and right bundle branches, and the Purkinje fibers. This allows the myocardium to contract and pump oxygenated blood through the aortic valve into the body. In Wolff-Parkinson-White, there is the aforementioned bundle of Kent, an accessory pathway between the atria and ventricles. This pathway does not share the same vital rate slowing properties as the atrioventricular node, which allows for early depolarization of the ventricles, as there is no delay in conduction. This can result in a re-entrant tachycardia, where the alternative circuit loops back on itself, causing rapid and abnormal conduction, leading to tachycardia and potentially arrest. This can cause random, sporadic periods of supraventricular tachycardia, which, in some circumstances, can lead to cardiogenic shock and/or cardiac arrest. Those with Wolff-Parkinson-White may actually present with no symptoms if the patient is not presently tachycardic. However, during a supraventricular tachycardia, the patient may experience palpitations, dizziness, dyspnea, and, infrequently, syncope. Other symptoms may also be noted. Wolff-Parkinson-White patients also have an increased risk of sudden death, especially when associated with atrial fibrillation. About 20% of patients with Wolff-Parkinson-White also suffer from atrial fibrillation, and atrial flutter in around 7%. Wolff-Parkinson-White associated with atrial arrhythmias has a higher risk of developing interventricular fibrillation. Diagnosis of Wolff-Parkinson-White syndrome is oft performed with an electrocardiography, or ECG. On ECG, several changes may be noted. An abnormality known as a delta wave may be seen. This is a slurred upstroke to the QRS complex. It is often associated with a short PR interval. This is caused due to the lack of the atrioventricular node delaying the electrical impulse, and the impulse instead bypassing the AV node via the bundle of Kent. The definitive treatment of Wolff-Parkinson-White is catheter ablation. This involves the insertion of a flexible catheter into a major vein, such as the femoral vein. The catheter is then advanced to the heart. Electrodes on the tips of the catheter can measure electrical activity and detect the abnormal accessory pathway. Once the area has been located, radiofrequency or cryogenic ablation is used to ablate the accessory pathway. During an episode of supraventricular tachycardia associated with Wolff-Parkinson-White syndrome, certain medications and interventions are indicated. Vagal maneuvers and adenosine are first-line therapies for regular narrow complex SVTs. Beta blockers and calcium channel blockers can be used as second-line therapies. However, for patients with atrial fibrillation and Wolff-Parkinson-White, the treatment can differ. Medications like amiodarone or procainamide can be used to stabilize the heart rate, with procainamide being preferred due to amiodarone's links to ventricular fibrillation. Electrical cardioversion should be used only for refractory SVTs and hemodynamically unstable SVTs. Initially, you should also obtain a 12-lead ECG if possible and monitor blood pressure and oximetry. Consider expert consultation if necessary. See Med Department Video 5 for more information on ACLS algorithms. Thank you for participating in this SCPF Medical Department educational video.